We're going to be injecting beads, these little translucent spheres that are held inside of the syringe right here to block off the arteries to the prostate gland.
Hi, my name is Preston, and this is a day in the life of an interventional radiologist. I'm an interventional radiologist at Summit Interventional Radiology. We treat patients, whether it's men's health, women's health, some cancers, artery or vein disease, and we use images to do that. So ultrasound, X-ray, or CT scan guidance.
So this is called an angiographic catheter, so it's meant for injecting dye into a patient's artery or vein.
Your team is very close-knit. I tell people that it's like being on a 5 or 6 man sports team, and you get to do that every day.
Our first patient's ready in room 12 for you, Dr. Smith. Consents are signed. All right, guys, we're gonna have a good day.
Hey, Gina.
Hello, Dr. Smith.
How you doing?
Good, good. How are you?
Doing okay? The skills you want to have in this job are good hand-eye coordination, the ability to recognize patterns and spot things that are different on the images, the ability to pay attention at a high level for a long period of time, and then the ability to communicate well, because you are going to be talking to all these different physicians and patients that are wondering what to do with their imaging results. Hey everyone, it is 10:03. We're getting ready to see our patient for a uterine fibroid embolization. This is a pretty straightforward procedure most of the time, so hopefully everything goes as planned. I'll see you in there.
So this patient that we have here today came to us because she's having heavy bleeding from uterine fibroids. So we are gonna take some pictures of the arteries in her pelvis, look for the fibroids, and look for the arteries supplying them. There are these little beads that we inject in patients. We kind of mix them up with dye so that we can see what's going on. I'm gonna connect this to our microcatheter and then it'll be bombs away.
To become an interventional radiologist, I went to 4 years of college, 4 years of medical school, 5 years of residency, and then an extra year of interventional radiology fellowship training. My next patient is a consult for a knee embolization. Hey, Dorike.
Hey, how's it going?
It's a patient that has pain and arthritis in his knees. So let's go see him, evaluate him.
Moving around is one thing, but at rest, it's actually hurting, like even just sitting there.
I looked at your x-rays already, so I think you're a good candidate for the knee embolization. So
Oh,
you're
I'll be excited.
You're ready to roll. Okay.
Yeah, I'd be excited to do that, yeah.
The reason that I love interventional radiology is because you can fix a lot of problems without patients having to get major surgeries. We do a lot of what's called embolization, a fancy term that means blocking off the blood flow to something, and we're able to drastically turn around their medical conditions by stopping bleeding, shrinking tumors, and really saving people's lives. We are getting ready for our next patient. It's a prostate artery embolization for someone with enlarged prostate symptoms. So hopefully our patient's got favorable anatomy and we're able to easily get into the prostate arteries. The pros of being an interventional radiologist are that you actually get to see and interact with patients every day, and you also get to use your hands to do procedures.
After this procedure, am I going to be really angry at you?
It depends on how many times you go to the bathroom in the middle of the night.
Oh.
You know, there are not a ton of doctors that have a great clinical practice and also a great procedural practice like interventional radiologists. The cons of being a radiologist is you will have to go through 10 years of training from the time you graduate college to the time you are practicing as a radiologist. But your reward is really great in the end.
So now that we're in a good spot, I'll kind of just gently mix these beads up a little bit, and we are going to slowly drip them into the prostate artery, effectively damming it off. And I'll watch and just intermittently take some x-rays and make sure the blood is flowing forward. And at some point it's gonna creep to a stop, and then we'll be done.
While many things we do are successful, you're going to have treatment failures every single day. You're going to be successful most of the time, and I try and hold on to that after I walk out of the office every day. Hello, Jennifer.
Good afternoon.
How have you been?
Good, how are you?
Doing good. How have you been feeling since we did the fibroid embolization?
Much better.
Much better? Okay. How so? If you want to become a radiologist, I would suggest that you find a radiologist somewhere in your area. It's something that you can read about online, you can look at a lot of pictures, but until you kind of see it in real life, it's hard to know that that's what you'd want to do. If you reach out to us, we'd be happy to have you and start helping out patients. All right, it's the end of the day. Everything went great today. We treated a fibroid,
we treated a prostate, and then we saw some interesting consults and follow-ups. It's been a great day today. It's my birthday today, so I'm actually gonna go home, relax, go eat a nice dinner, spend some time with my wife, and then I'll wake up tomorrow and do it all over again. Thanks for watching. Be sure to subscribe to our channel and search Indeed for more A Day in the Life videos. We really appreciate it, and we'll see you next time. Is that close? Is that close to the lines? Okay.